This episode is brought to you by SureTest. Transform and revolutionize your health system's application testing process with SureTest Managed Test Automation Solution, SureManage. Eliminate 80% or more of your manual testing activities, reducing errors and reclaiming thousands of hours for your staff to focus on more rewarding, strategic projects. Continuous testing is critical, and getting it right saves lives. Discover the future of healthcare IT automation with SureTest. Visit thisweekhealth.com/SureTest today and elevate your healthcare system's performance.
Welcome to This Week Health. My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Now, on to our interview.
All right, today we're doing a solution showcase, and I am joined by Laura O'Toole, the CEO of SureTest, and Robin Parkin, the CIO for UVA Medicine. Is it UVA Medicine or UVA?
UVA Health.
UVA Health. Got it.
Yep.
Fantastic. Thank you guys for joining. This is our second time recording this, and I can't believe in the 8 years we've done the show, we've only had 3 recordings not work out, and the recording we did while we were at Vive did not work out. So I'm looking forward to revisiting this. When we were at Vive, we talked about how you guys, what are some of the things you guys were doing at UVA, and what are some of the problems you were looking to solve by partnering with somebody like SureTest. So Robin, I'd love to start with you and you see, what problem were you looking to solve at the time?
So we never have enough people to do the work that is demanded of us. So one of the things that we really wanted to do was to, I'll say, find more time. That was the original idea behind going after SureTest, and that certainly has given us a lot of hours back that we can reuse and purpose for something else. But some of the other things that maybe we didn't anticipate is our team members really didn't care for manual testing. It required a lot of coordination and work on everyone's part. And so having a process that would handle that on our behalf, and we didn't have to deploy people to do it all, it's worked out really well for us.
And Laura, I'm sure you hear that all the time. That's a common refrain, both of those, so that the team that has to do the operation on a daily basis doesn't necessarily appreciate doing all the testing that's required and the regression testing and other things that have to happen with every change that's made to the system, plus just resources, just time and people. Talk a little bit about some of the conversations you're having in the industry and what people are looking for.
Yeah, it's really interesting. And Robin and her team have just been such a phenomenal, fabulous partner for us. And I think actually we just went through and are going through a renewal for another 3-year contract with UVA. But, much like Robin said, it's interesting. People don't realize how much time they're spending on manual testing and all the components of manual testing. A lot of times people just think about that 2-week upgrade period or where you have to take a particular monthly SU. What they don't think about is making sure that the scripts are continually maintained and updated and that documentation is all in place and preparing the conference calls to do the testing, preparing the time to report back out on the testing. And all of that with a solution like SureTest is done completely in a turnkey way. So it's been really enlightening over the last few years to watch our clients kind of evolve with us and really begin to see the benefit of taking a solution like SureTest, incorporating it into their day-to-day work and into their organization. So as Robin said, they truly can get thousands of hours back to work on more strategic projects. We have some clients that actually use this as a recruiting tool to say, hey, you come work with us, you don't have to do manual testing because we have a partner in SureTest and we have automated that process. And it's really a joy to watch clients be innovative and be a part of the innovation journey that so many of our clients are moving toward today.
Yeah, the automated testing is interesting. Robin, I want to ask you, because I've talked to some other SureTest clients, and it's interesting. They start with one thing, and then they're like, hey, I think we can use this over here, and it can also do this. Did you have that same experience?
Well, we've actually had some conversations with Laura and her team about other ways to use the tool that are beyond testing. I think Laura is considering some of those things, but we haven't taken any steps in that direction. I do have to say, though, that one of the other things that we get out of this is we're able to test all the time, anytime. It can be on the fly. If we put something in production and we notice something, we can run these scripts, and it's just a lot more rigor and keeps us more stable. And our environment we don't encounter the kinds of problems that we may have encountered in the past, where we have our end users calling us up and telling us we have a problem. We get the opportunity to find it before they do.
That's definitely the beauty of the solution. Our goal is to do this continual regression testing so that by the time you get to a major upgrade, it becomes much less of an event, if you will. So that has been cool. And Robin, you may not be aware of this, but we have recently started to talk to your team. We have now built probably 30 or so third-party surround applications in our library, to your point, because our clients have come to us and said, I want to do a round trip automation, or I want to include this third party, or now let's start to look at moving up the enterprise even for things like Workday. So now that library continues to get robust, because my ultimate dream for the company was really that all of our clients were going to share in this de-identified knowledge to be able to help them on their journey, just move up the value chain in terms of automating more and more.
Just those two concepts again of there's testing going on in your system probably right now while you're sitting here talking to me, because that automation just happens in the background and make sure that the system is running. Plus the flexibility and expandability is really fascinating. What's the lift look like? Robin, what's the lift for bringing a SureTest in? Is it like a year-long, big, massive project, or what does it feel like for somebody?
So for me, it didn't feel like a project at all, with considering some of the projects that we have, because SureTest carries a lot of that weight. So we have to provide the materials, they run those scripts, and they build those methods for us to be able to do the testing. It's really awesome. And our teams, it's more about the rigor of keeping everything up to date and everyone informed is what makes it all work well.
Yeah, it's been a great methodology to be able to bring our methodology in terms of how we identify the client's individual workflow. And we have a very specific approach to that, especially now. And Robin's team, if you look at what UVA has done, they've been an innovator. I believe they're the #1 hospital in Virginia. So actually our partnership with them has helped us evolve our methodologies to the point that now when we come in to a health system, we have a very methodical way of capturing that information for the particular area of that workflow, where they can come in, show us their workflow quickly, and they can leave and go right back to their work. So we're taking small amounts of each team's time in order to really record what we need to do. And then, of course, we go through a validation phase, and that becomes very iterative. And over time, it becomes our responsibility to continually keep those scripts up to date. So after the initial workflow capture, the lift is extraordinarily minimal for the health system.
So Robin, I'm going to do a case scenario here. Let's assume I'm going to take a SureTest away from your environment. What would happen like over the next couple of weeks if I took it away?
So we would have first, probably with the news that it was going away, a lot of very unhappy employees within the IT organization. But then we would have to figure out how to gear back up to be able to do this work that we haven't been doing in a manual way. And that's going to be very unsatisfying, I think, to everybody, including our operational partners who get the benefit of us having that done the way it's done right now.
Yeah, but you probably have the head count, right? You just hire as many people as you want.
Oh, no. No. I wish. We would have to figure out how to do it with the people that we have.
Everything is heading in this automation direction. I know that every 229 meeting that we have, there's a conversation around efficiency and driving automation and really unlocking some of those capabilities because of the pressure that a lot of health systems are under. Hey, by the way, congratulations, UVA #1 hospital in Virginia. That's a great accomplishment for the team.
Certainly is.
Yeah,
Um,
indeed. And you know, Bill, I think Robin and I should have talked before we came to this call because we're members of the Yellow Hat Club and we should have been wearing ours.
I could have done that.
I
That would have been awesome.
appreciate you guys. It's been a great journey. This community is so generous. And last year we raised $130,000, and this year we're already up over 150, and it's only April. And it's contributions from people like you. I do want to talk to the two of you. This is a little self-serving, but I want to talk about women in leadership. It's rare that I have two female leaders of your stature on a call like this. I'm curious, are we making progress in that area where there's more opportunities, there's more people stepping into those roles, or is there still a ways to go? Laura, I'll start with you.
I don't know how Robin feels, but I've been in healthcare technology for my entire career. And it has certainly been, a struggle to rise up to a key leadership role. And I continue to see in healthcare technology that I think, are doing a good job of rising up our women leaders. But from my perspective, there's still not enough that have a seat at the table. So I'm excited to continue to watch that journey shift.
And Robin, I would assume you're seeing the same kind of thing.
We certainly have a lot of really strong women leaders at UVA. I do think that it takes a lot of focus on the part of other leaders like Laura or myself to be able to see the potential in other women in healthcare IT and help them along, because sometimes they don't think they can. They don't expect some of the same things that maybe some of our male counterparts in those departments might feel that they aspire to be, something that some of these women may not know that they could actually accomplish. So you have to pull them along sometimes and help them.
Is there something we could do at the industry level? It's interesting because we do the 229 project meetings, and I would say that it's indicative because we have CIO meetings or CMIO meetings. And invariably, it's because it's an IT space, because women are fairly well represented in healthcare in general. But in the IT space, it's 20% of the seats. And I think that's probably the average across the industry because we've been doing these events for a while, and it seems to always be right around that number.
When I get into the IT department and within my own organization, where I see the proliferation of women in IT is where somebody is coming out of nursing to do IT work. Like maybe it's epic inpatient work or orders or that type of thing. It is not someone who trained in technology, who decided they wanted to go into healthcare most of the time, which is what I did. So I was a software engineer. And
you must have been the only woman in that class.
that's a long time ago too, so even less of them.
Oh man. Nope. I think there's a lot of truth in that. We've done a lot around STEM. We've done a lot about promoting for young ladies to head in that direction. I'd be curious to walk into some of those universities and see how their percentages have changed and if that's going to lead to a change. We did a chief technology officer meeting and there wasn't a single woman in the room. And I thought, yeah, that's a very technical role. I'm sure there's women who do it across various industries, but just in our meeting, there wasn't one in the room or representative.
Yeah, I definitely think the STEM programs are significantly helping. I think just the focus on women in general in technology, we're seeing whether you're going to HIMSS, whether you're at Vive, whether you're at Shine Fall Forum, there's been several groups that have begun to pop up that I think are really beginning to make some traction. And certainly I think that will help. But I think just leadership in general, Bill, I believe leadership is really about the ability to connect people and to influence in the right direction. So I think whether it's in technology or across the health system, where people like Robin and I have an opportunity to just help rise up other women, it's going to continue for me to certainly be a focus, because not to say that there's anything better or worse, but it's always good to have diverse and different perspectives at the table.
Yeah.
Yeah. Absolutely. And Robin, I'll close with you because one of the things I remember, I was interviewing for a CIO job way back in the day, and they were saying, well, you don't have enough experience with this specific technology. And I looked at them and I said, if your CIO is logging into that system, you've hired the wrong person. It really is a leadership role today. It's an influence, it's a budgeting role, it's a mentoring role, it's a organization, it's aligning your resources role. It's not speeds and feeds like maybe it was 20 years ago, and more tech, like what kind of hard drives are we going to use in the computers and that kind of stuff. It feels to me like it really has transformed almost completely to a leadership role.
There is a tremendous amount of simple management and strategy kinds of work that needs to be done. You're struggling with and trying to put strategy around staffing and how to get work done and not grow your technical debt. You're trying to do rationalization and shrink your technical debt. All of those things are problems that any kind of business, I think, has to deal with, not just IT. So it's not really about technology. It's about the right processes, hiring the right people, and having the right strategy.
Yeah, fantastic. Well, Robin, Laura, I want to thank you for sitting down with us, and I look forward to catching up with you guys again here real soon. Thank you.
All right. Awesome.
Thanks, Bill.
Thank you.
Thanks for listening. If you found value in this, share it with a peer. It's a great chance to discuss and in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, would be great. Thanks for listening. That's all for now.